Online gambling in general is really a rapidly growing industry, and that's been affecting both adults and young people. Hello, and welcome to the Dr. Suzette Glasner podcast. Don't forget to hit like and subscribe to my YouTube channel if you want to continue to learn from me. Today, we're going to talk about problem gambling, which is something that has been coming up in the news quite a bit as the FBI recently announced the arrest of more than 30 people in connection with a pair of alleged gambling rings on charges of conspiring to commit fraud, money laundering, illegal gambling, and extortion. And among those who were arrested were Chauncey Billups, Basketball Hall of Famer and current Portland Trailblazers head coach, and Damon Jones, former Cleveland Cavaliers player and coach. The investigations involved an alleged sports betting conspiracy and an alleged scheme to rig illegal poker games. One player agent said, "Surprised they got caught, but not surprised as gambling is happening everywhere." And that's certainly consistent with my experience clinically and my observations and what we're seeing from the scientific literature on gambling disorder and gambling addiction. So online gambling in general is really a rapidly growing industry, and that's been affecting both adults and young people. Just for a little context, sports betting is now legal in 38 US states and the District of Columbia, and in 26 states, a person can now make a sports wager on their cell phone legally. Not surprisingly, at the same time as these regulatory changes are occurring, we're seeing an uptick in activity on problem gambling helplines, and surveys are suggesting that there has been an increase in both gambling participation and in people who are seeking out help for problem gambling. And the largest increases have been seen in jurisdictions that allow online betting. So if you step back and think about it, mobile access to gambling has really transformed the whole psychology and the psychological process involved in gambling. It shortens that cycle of urge and then the opportunity to act on the urge to bet or gamble in some way. And it really compresses that into seconds because you can do it right there on your phone. It's like you have a casino in your pocket, literally. And that really amplifies the risk that you're going to escalate that kind of behavior repetitively, very rapidly. And that can lead to gambling addiction and some real financially and personally destructive outcomes from that and consequences. So gambling disorder was actually added to our diagnostic system for mental health disorders in 2013. And that was after there was a growing scientific literature that was really showing that gambling disorder shared a lot of overlap in terms of the behaviors and the patterns of addictive behavior that we see as very well established in relation to drug and alcohol use. It actually is still the only behavioral addiction that is recognized in our diagnostic system for mental health disorders. It's also known as the DSM. So who's at risk for developing a disordered gambling? Because a lot of us have tried gambling, can have fun at a slot machine if you go to Vegas, or just kind of enjoy betting and anything that would be categorized as risk-taking in the gambling sense. And only a certain proportion of those people are going to go on to do this compulsively and in a way that brings about problems in their life. So what are some of the risk factors from research? People who are at higher risk of developing what we would diagnose as a gambling disorder tend to be male. They tend to be young and single or married for a relatively short time, for less than 5 years. You're at heightened risk if you live alone, if you have a low level of education, and if you're struggling financially. Even though it's not a great way to improve one's financial situation, it's one of those things that might have greater appeal to somebody who is struggling in that department and trying to find a creative way to make it. So like people with drug addiction, people with gambling disorders experience cravings. It's like as though the kind of stimulus for gambling, which could be your phone or could be a casino, but people experience cravings for the experience of gambling in the same way that they will experience a craving for alcohol or another substance if they're dependent on it physically and psychologically. They'll also develop tolerance. So the same amount of engaging in that gambling behavior just doesn't give them the kind of hit of dopamine or that sort of like rush and good feeling that it used to. And they have to sort of start betting in larger amounts or taking sort of greater risks in the context of gambling in order to feel the same kind of rush of pleasure or the kind of level of excitement that they're seeking to experience. So again, also like addiction to alcohol and other substances, a person with a gambling disorder can't really control their gambling, and they start to experience negative consequences in their life as a result. They start to typically experience financial difficulties and relationship problems as a result of it. And then you have this whole factor that is somewhat unique to gambling, the profound effect that this particular addiction will have on one's financial standing. So of course you could go into debt over a drug addiction as well, but it's more of a pronounced symptom of a gambling disorder when a person starts to have significant financial problems that it feels like they can't get out from under. And then they also tend to experience a lot of shame around having made the decision to continue gambling, getting further into debt, and complicating their life and potentially their family life and the lives of other people they know even further. And because of those features, in part, the sort of shame factor and the stress and anxiety that's brought on by the type of profound financial problems that can result from compulsive or pathological gambling, we do see that this is an addiction that is associated with particularly elevated rates of suicidal thoughts and behaviors, as well as completed suicides. So it's actually quite serious for a lot of people. People with gambling disorders often also have overlapping substance use disorders, so that complicates it even more, that they may be also a little bit more impulsive around their gambling and making poor choices because they're doing it in the context of also using alcohol or other substances. And that's also at the same time compounding the impairment in their judgment that leads them to make some of these decisions. And we also know that gambling shares some of the neurobiological kind of underpinnings of other substance addictions. So there's dysregulation of our feel-good chemical dopamine in people with gambling disorders. There's impairment in impulse control, as we also see with drug and alcohol use disorders. And we know that mobile technologies have really transformed the landscape of gambling and gambling disorders in a way that you might think about in parallel with the way that synthetic opioids or synthetic drugs have really transformed the drug landscape over the same period of time. And what I mean by that is that some of these highly potent opioids that have hit the market, like fentanyl, and become easier to access, have accelerated the progression for some people into an opioid addiction in a similar way to what we're seeing with online gambling and the ability to just take your phone out of your pocket or your purse and access this like highly potent experience from a reward sense of the sort of thrill and excitement of gambling. It's so easily accessible and the cycle is so brief of having that urge, performing the behavior, receiving a reward or not, and trying to do it again. That access and that potency of that sort of experience can lead people to much more rapidly progress into what we refer to as pathological gambling or a gambling disorder. Hand in hand with that goes this sort of legalization of online gambling. It really has fueled increases in really irresponsible or risky gambling, especially among people, unfortunately, of lower incomes who are really detrimentally impacted by the financial losses that can result. And then there's this whole problem of adolescents whose brains are not fully developed, who haven't really formed the kind of connections in their brain and in their frontal lobes that would enable them to control their impulses and exercise good judgment and think carefully about the potential consequences of their action before acting. And so exposing them to really easy access to something like online gambling can really activate their potential for engaging in risky, impulsive behaviors. I know in our local area here in Los Angeles, there have been several high schools who have been dealing with really significant problems with their students engaging in online gambling in the bathrooms during school hours and really having to crack down on that and try to get a handle on it. So it really is like becoming a broader problem. So let's talk a little bit about treatment. Our go-to therapy for gambling disorder is known as cognitive behavioral therapy. And in cognitive behavioral therapy, the focus is really on understanding the sequence of behaviors in slow motion of what happens when a person makes a decision to engage in gambling, even though the gambling is causing some destructive consequences in their lives. It usually starts with a trigger. So in cognitive behavioral therapy, we try to understand what are the triggers so we can anticipate them ahead of time, avoid them or avoid unnecessary exposure to them if it's a certain place or certain people that you used to gamble with, but then also planning if you are exposed to the trigger and you do experience an urge to engage in gambling behavior, what are the healthier coping strategies that you can use in order to control yourself and refrain from engaging in that behavior. And when you do that repeatedly over time and you do that successfully, you build confidence that you don't have to act on those impulses. You don't have to act on those cravings. The urge can come and go, and you can make a healthy choice in replacement of the gambling behavior. And as you build that confidence, you start getting better and better at resisting those urges. So that's pretty much what we do in cognitive behavioral therapy. It's a bit more involved than that, but those are some of the basics. And then there are also motivational therapy techniques where a therapist will help an individual to establish what are their core motivations for changing this very destructive behavior so that they can continue to revisit those when they're experiencing a weak moment, when it's really easy to forget all about it, listing those out and really looking at the pros and cons of including this practice of gambling in your life and reminding yourself consistently with the support of a therapist why you're going to all this trouble to break this habit or create a gap in this behavior so that you can turn the page on this chapter, which, by the way, can be a long chapter, but is a completely treatable one. It typically takes 1 to 2 years for an individual to fully recover from a gambling disorder with effective therapies like cognitive behavioral therapy. So it's a long road, but in the grand scheme of a person's life, 1 to 2 years to restore your life fulfillment, to restore your finances, your health, your relationships, and get back to a normal life, given how destructive gambling disorder can be, is not all that bad. Couples therapy can also be really helpful because this is one of those addictions, although not unique to gambling disorder, all addictions have an impact on the family, but because of the specific destruction to one's finances, that can really impact the family structure in a kind of a unique way. So often couples therapy is really helpful just in terms of the accountability, the commitment of both individuals as a couple to working on this problem together with support. And that also can motivate the person with the gambling disorder to stick with it and stay in treatment, which is super important. Another piece of good news is that there has been some research on different types of gambling, because I'm talking about this sort of shorter addictive behavior cycle with online gambling. And the good news about this 2-year longitudinal study that followed people with problem gambling over time who received treatment was that it didn't really matter whether they were involved in online gambling or in-person gambling. The treatment was pretty much equally effective for both. Finally, we don't have any medications that are FDA approved for gambling disorder, but what's interesting is that the medicines that we have that are effective and that are approved for alcohol use disorder, such as naltrexone, have really the strongest evidence among medication treatment options in their efficacy to reduce the urges to gamble and gambling behavior in some patients. And that's the same thing that we see with alcohol use disorders. Naltrexone effectively reduces cravings for drinking and reduces drinking behavior. So again, some more evidence that there's overlap between these conditions as different forms of addiction. The problem is that we have a pretty low proportion of people with gambling disorders who actually seek help or seek out support groups. It's between 7 and 12%, and that's quite low. So the point I want to leave you with today is that if you see that someone who you care about, or even in yourself, that you're finding it difficult to control how much you're gambling, how frequently you're gambling, if you're finding that you're needing to chase losses or you're needing to gamble more in order to achieve that same kind of feeling of excitement, if you're having financial problems related to gambling, or if it's just interfering with work or you're distracted or other important life roles that it might be interfering with, please reach out. There is help available, and I'll give you the number of a hotline that you can call or text, which is 1-800-GAMBLER, and that's the National Problem Gambling Helpline. They can connect you with local resources and treatments, programs, and or specialists in gambling addiction. But really, anyone with addiction expertise should have a good understanding of what this is and be able to help you, if not routing you to somebody who can help you. I hope you learned something valuable that can impact you or someone you care about, and I look forward to seeing you next time.